If you were to ask me, what can I expect when I go see a neuropsychologist following a concussion? And the answer to that is it really depends on what the symptoms are, what your concerns are, and what you're looking for at that point in time. At the most basic level, you can expect a neuropsychological evaluation that may take anywhere from 45 minutes to an hour and a half, really to take a look at your thinking abilities, your cognitive functions, all of the things that tend to be affected by concussion, in addition to psychological factors. Other things that you could expect is really talking about your life and how you come to be the person you are sitting in front of the neuropsychologist at that point in time. Because nobody has a concussion in isolation, right? We all bring a history to that first meeting. So I want to understand a little bit about you. Is this your first concussion? Is this your sixth concussion? Have you had lots of buddies with concussions? Have you had lots of friends with concussions? What have been their experiences? And then I want to know everything I can find out about the concussions you've had, because I want to be able to create a profile of you in my head to help then sort out what the issues are that you may be having. And then once we sort those out, then we can identify targeted treatments to help those areas. For example, you may come to me and we find out that you're really worried, that you're really anxious, and you tend to be a person who tends to be a worrier. So what are we going to do? We're going to figure out, okay, what are you worried about? Is it realistic? Is it not realistic? And if it is realistic, what can we do to help you better manage that worry? Because we all worry. This isn't just because of the concussion. It's to help you manage that worry. Just like you may come in and you may feel really frustrated because you can't play the game, you can't watch TV, you can't do all the things that you like to do because somebody has told you to put yourself in a cocoon and to not do anything else until all your symptoms go away, which is, by the way, the worst advice that you can ever get from somebody. So what we need to figure out is, what are the things that are bugging you? What are the things that you can do and do them more? And what are the things that are causing you difficulty? And then how do we figure out a way to gradually start adding things in so you get back to being the normal person that you were before you got hit in the head?